August is National Wellness Month, so we thought it might be helpful to look at key ways to keep your health in check. Dr. Stacy Chronister is an internal medicine specialist with OSU Medicine, and she joins us once again. Great to see you.
Same.
You know, they say that it's important to get these tests. It's important to kind of stay ahead because early detection can make a huge difference.
Absolutely. We don't just want to treat you when you're sick. We want to keep you healthy. We want to prevent you from getting sick. But some of these things can be caught very early. That way we can get on top of it right away. And we're here and would love to help you do that.
All right. So we want to kind of go through the decades.
Okay.
I think because people say, well, should I have a mammogram or not? Should I have a colonoscopy or not? There
Absolutely.
are some guidelines, and it makes it pretty simple. So we'll start with our decades of the 40s.
Okay, I love it.
Yeah.
So at age 40 is when we really start looking for diabetes and heart disease screening. That's when we're kind of looking for cholesterol and maybe a few other things if it runs in your family, like skin cancer. This is typically when we're starting mammograms. Some people don't start until 50, but a lot of people are doing every 1 to 2 years at age 40. And Pap smears started at a younger age, at age 21, but we are continuing those every 3 to 5 years through age 40, and now colonoscopies start at 45, not at 50.
Well, and I think a lot of people are I started to say a lot of people poo-poo colonoscopies. I know. I'm just going to say it. But the thing I think about it, it's a very challenging test to take, yet the outcome can be significant. It is a silent killer.
Not only can you detect cancers, but they can actually remove itty-bitty cancers. What's nice is that most colon cancers take a long time to grow. So it takes about 10 years, which is why you only need a colonoscopy every 10 years for that to grow into cancer. So if you go in, you get a colonoscopy, even little lumps that could turn into cancer, they get rid of it. It's like getting screened and treated at the same time.
Okay, let's take a look at our 50s.
Okay.
This is another, we enter that fifth decade and we're like, wait.
And everyone says, patients come in and they say, I'm 50 now, I guess I need all the tests. And I say, really, it kind of looks the same. So we're going to continue screening for diabetes, heart disease. We're really screening for hypertension in these ages. But we started colonoscopy screening a little bit earlier now. We're doing 45. This is where those who are smokers are now going to start getting lung cancer screenings, looking for the damage to their lungs from that long-term smoke exposure.
What does a screening look like?
It's a CT scan once a year.
So you're
low-dose CT scan.
Looking at the lungs?
Yes, we really can't see those itty-bitty lesions with an X-ray. X-rays are really good at picking up bones, but not picking up those fine organs and those little lumps that are made of things that aren't calcium. So we use a CT scan to do it.
Okay, let's move on to our 60s and beyond.
So 60s, we're really talking about how are we going to keep you healthy over the really long term. So of course, diabetes, hypertension, heart disease, but we're really now looking at if something were to happen to you, how can we prevent that from being a bad outcome? So we worry about things like falls. So we might be doing some stand up and walk around for me. Let me see how strong you are for fall prevention, and also screening to see how thick your bones are so that if something were to happen, we don't have a fracture. This is where we're being really careful about vaccinations because our immune system starts to drop off as we age. So we want to make sure that you have enough immunity around for pneumonia, shingles, pertussis, RSV, the ones that are really going to put you in the hospital at this age because you don't have the same amount of vigor and an immune system.
And some of those vaccinations need to happen yearly, but like the shingles shot is a one-time, one and
well,
done.
yeah, you have to get a couple of them.
But once you've had it, had the shot,
you are done.
Yeah,
yes.
and I think, and if anybody has ever had shingles, I've heard it is the worst pain.
Absolutely, it's neuropathic pain, so it's nerve pain, and people, I mean, you just can't get rid of it, and oftentimes you can't even see it. It just lives there forever. And depending on where it is, if it's on your back, maybe you can get over it. But what if it's on your face?
Into the
how
eye?
miserable.
Yes. I'm a big proponent.
Yes.
I've already got that shot. You know, I know pneumonia is critical because that's how so many people, older patients, get in the hospital, and that pneumonia can really
absolutely. There's other things like our hearing and our vision that start to decline at that time, and it happens so slowly that we don't really notice it. So making sure, you know, has anybody said, hey, have you had to turn up the TV, or Dad, hey, turn that down, or you're not hearing me? Let's start getting hearing exams here so that way you are living the best quality life that you can.
And there are great devices that can be utilized to help you to attain that. Once you kind of hit that 75 age and older, I think it's really critical. I mean, we are living longer. A lot of people have great family histories, so have those conversations with your doctor if you want to continue some of these tests.
Absolutely, and everyone gets a free preventative health
Check.
appointment a year. Use that for preventative health. Don't come in with a list of complaints that day. Come in and allow us to talk to you about your weight, talk to you about your nutrition, talk to you about your exercise, because that will actually give you a lot more longevity in life.
Great. One thing we didn't really hit on was prostate cancer and the PSA test.
Next month.
That's going to be our September topic for sure. Great to see you. Thanks for coming in.
Thank you.
We appreciate it.